Welcome to my channel. I'm John Peters. I'm a therapist who's been in practice for 25 years. And this channel is about me sharing a wide variety of wellness tips and thoughts about therapy that I think potentially could be interesting and broadly useful. So, in today's video, I'm going to talk about a common expectation that people have that when they go into therapy that they're going to have to talk about their childhood a lot and as a central part of their practice. And I'm going to talk about how to kind of understand how that really works as therapy exists today, and in particular so that that's not a barrier to you or someone else who's contemplating starting therapy. So stay tuned. Okay, so in this video, I'm going to talk about the expectation that people have that they have to talk a lot about their childhood. And the main reason that I want to address this, there are two reasons. So the main reason is for some people, this is a barrier to therapy. And I'll say a couple more things about that in a second. But number two, also, because of that expectation, I think that it kind of can potentially confuse a patient as they're in that beginning stage of therapy and kind of formulating what they're going to be up to with their therapist. And obviously, every therapist has their own style. Some therapists might find the past and someone's childhood, more relevant to the therapeutic process. But this will make more sense as I explain it. So issue number one, the reality is that a lot of people, because of the expectation that they're going to have to delve into, rich detail of their childhood, then it keeps them from actually going to therapy. And I'll give you an example. I talked to someone recently who shared with me that their wife was having chronic anxiety, had as long as the patient had known his wife, for years, and that at times it was just really debilitating and making her miserable and making them miserable. And he had, in many different ways, gently but firmly, requested that she go to therapy and tried to support that. But she was resistant. My patient shared with me that the main reason that his wife didn't want to go to therapy is because she had a very complicated history and a very complicated, kind of stressful relationship with her earlier years. And she just didn't want to go to therapy. A lot of people imagine if they go to therapy and they kind of open up that box of the past, that it's going to be overwhelming, because it is overwhelming. Pre going to therapy, people think about, oh, do I want to open up that box? Well, I can just barely cope with it now, and I can barely cope with it by kind of keeping it as closed as I possibly can. And why would I want to open that up, right? I'm already feeling overwhelmed by it. If I open it up, that's going to tip me over that edge, right? So that's kind of the logic that people have in terms of not wanting to open that box and not wanting to open it in particular by talking to a therapist who they think is going to ask them to expose themselves to that vulnerability of that past that's already very stressful, right? So it's understandable. People don't want therapy to overwhelm them. Now, it is true that it is a reasonable expectation that when you go to therapy, although the long term goal is to overall improve your functioning and reduce your stress, that in the short term, there could be some challenge. Now, the good news about that is that when you face that challenge in therapy, you're doing it with someone that hopefully is competent to support you to safely be able to explore that material so that you aren't overwhelmed and so that you deal with it constructively and synthesize it in ways that are good for you moving on, right? But I understand that people are reticent to open that box, even if they think I could get something good out of therapy. And this case that I mentioned as the example, that's just one of many, many times when people have said that type of thing to me about a family member or themselves. Like, I don't want to go to therapy because I don't want to talk about my childhood. So let me explain a little bit about why that expectation is not crazy, but why that expectation shouldn't be a boundary and keep you from going to therapy if therapy could be good for you, right? So here's why that exists. And we have to go back and blame it on Sigmund Freud. So Freud was writing psychological theory at the beginning of the 20th century. So in the early 1900s, Freud was working out and publishing and becoming his theories and became wildly popular. And so according to Freud, the kernel of understanding of human development was that early on, we went through these early stages of development. We developed our ego, our self, and that development could either happen in an optimal way where we became a healthy adult, or it could be suboptimal, which is why Freud was writing. We're thinking about dysfunctional psychology here, like when things go wrong. And so Freud thought, well, when things are not good for a person's development, and then they have issues later, let's say clinical depression, that Freud thought that 100% you could explain this as some problem of navigating those early stages, plural, of early development. And so because of that, Freud's theory rests on that assumption that later problems are always a result of early problems. And therefore, to deal with a later problem, like I'm depressed right now as an adult, you had to go back and work out whatever happened earlier. And this is why classical Freudian psychoanalysis literally was expected to be a 20 to 30-year long process, going to see your therapist weekly, lying down on the couch while your therapist sits there and nods and says, mm-hmm, mm-hmm, tell me more about your childhood, right? That was classical Freudian psychoanalysis, right? And it was very, very popular and powerful, and Freud's theories continue to this day to be very powerful. However, back in the middle of the 1900s, so let's say a little before and through and after World War II, that was the ascendancy of cognitive behavioral theories. And the big, radical difference of cognitive behavioral theories from Freudian theories was that there are some problems that are open to change, uh, that don't require you to go back and rework your whole childhood, and that quicker change can happen, and change that's not dependent on working out your childhood. There was a joke I saw one time, and I can't tell the whole joke perfectly because it's been many years, but the joke was about four Freudian psychoanalysts who decide to take a road trip together, and they get in a car and they drive off. Shortly down the road, they have a flat tire. Okay, so the flat tire represents current dysfunction. And instead of like getting the jack out and jacking the car up and changing the tire and going on down the road, the four Freudian psychoanalysts, who all assume that current problems rest on former childhood issues that need to be worked out, they sit down on the side of the road and start psychoanalyzing each other to try to figure out like whose relationship with their mother when they were a child resulted in this current problem of the flat tire on the road trip, right? So the joke is about how there are these limits to Freudian psychoanalysis. Are there times where we need to talk about the past? Yes. Are there times where there are intricate kind of details that need to be carefully examined and reworked about the past? Certainly. But these days, most of us, me included, while we do consider that as one kind of frame through which to view a client's presentation and their history and what might be relevant to crafting a helpful therapeutic process, we all actually are mostly influenced by these cognitive behavioral theories, right? I'm going to make another video soon about CBT, DBT, ACT, psychoanalysis, kind of how do all these fit into different therapist styles and what people can expect from therapy. But the thing is, sometimes the best thing that you need to do is just jack the car up and change the tire and go on down the road. And we can do that without talking about your mother, right? We can do that. And I'm not the only one who thinks this way. This is the general thinking. Now, there are people who are more Freudian and more into psychoanalytic theory. Sometimes we therapists put that kind of thing in our profile. I tend to tell people up front, I'm not really a psychoanalytic practitioner. I'm not the one to do that if that's really what you want. But part of what you can understand when you're looking at profiles for a prospective therapist is if you see CBT, DBT, and ACT as code words, so cognitive behavioral theory, dialectical behavioral theory, therapy, and acceptance and commitment therapy. If you see those acronyms in a therapist profile when they say what they do, that's basically code for you don't really have to talk about your childhood any more than you want to. And even if your childhood does matter, it's still okay for you to be appropriately careful and guarded and measured in how you share that, even with your therapist. The fact that like a patient's working with me does not mean that they have to commit to be on 100% open with me. If they want to make a vague reference to something in the past and then later decide whether or not to talk about it more richly, absolutely okay. I can think of a recent example where I had a patient like that. The patient really did have a lot of reservations about getting too deeply in a discussion about certain aspects of her past. So I noticed over the course of our working together over a few months, she was progressively more open about it, which was fine with me. And in fact, sometimes you can work on issues while being fairly abstract and not particular because you might not want to talk about it specifically. Like sometimes you can get competent help from a therapist by being relatively indirect and saying, "Well, I've got this issue and it bothers me, and when it pops up, this is how I react to it." There are different levels of specificity with naming and zooming in on an issue, and if it's more comfortable for you, especially in the beginning, to be kind of measured and somewhat guarded, that's not inappropriate, and it's okay. So that's the history of kind of how we got to where we are today. But I wanted to make this video because I know that there are folks out there, because of what I hear from what people say about their own reservations about coming into and committing to and following through with therapy. And like I said, what I hear people say about family members and friends and loved ones often about like what's a common barrier to going to therapy. And it makes sense to me. Again, people don't want to open up, something that they think is already almost overwhelming or is overwhelming in a way that then makes them worse instead of better. But just know that you can be an active participant in crafting the goals and the processes of therapy. And if you are, conflicted about whether you want to be working with a therapist that's going to require you to super richly dive into your childhood, that is okay. And it's okay to name that as an issue and say to your therapist, look, I'm not sure how much I want to do that kind of focus. Because again, there are a lot of problems that we don't need to do that anyway. And so it's fine to be clear, like, I want to focus on how I'm doing now. I want to focus on how I'm doing in the future. To some degree, we therapists may ask questions, especially when getting the history, at the initial session and in the beginning stage, just so we understand the person well. I want to understand you if you're my patient. And part of that might be, what have you been up to in the past? What went on earlier in your life that you think is relevant. But that does not mean that then we get committed to, okay, well, let's go back to your childhood, when such and such happened, and just absolutely, start there and slowly work back to now. Let's just be now, like be here now and figure out, how do you want to be in the world now? How do you want to experience yourself now? What are your goals? How can I support that? Again, the past is relevant to that sometimes, but doing all of that is not dependent on getting deeply involved in the past. So, hope this was helpful. And if you like this kind of content, feel very free to hit the like button below. And as always, I'm super open to comments because it helps me understand how my channel is landing on folks and helps me craft, how I want to shape this channel moving forward. And I will see you in an upcoming video.